بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about discussing the signs of pneumoperitoneum. Pneumoperitoneum is a free air in the peritoneal cavity. There are multiple signs. We should know most of these signs because the diagnosis is ominous and it is important for the patient life. Here, this is some classification of the signs of the pneumoperitoneum. It is described as bowel-related signs and right upper quadrant signs and peritoneal ligament-related signs and other signs. And we will discuss most of these signs. Bowel-related signs, we have two signs. We have a regular sign and a triangular sign. Regular sign is also known as double wall sign, and means it is visualization of the bowel wall and requires large amount of pneumoperitoneum. As in this supine X-ray, we have pneumoperitoneum and the wall of the bowel is visualized because it is outlined by air from outside and outlined from air from inside and will appear as a white wall, as in this here, and this here. Here also another example of regular sign, and we see the bowel wall here. Sometimes differential diagnosis of overlapping bowel loops and will confirm with upright or standing film. Another example of a regular sign, as we see here, dilated bowel, and the bowel is outlined by the air outside and air inside the bowel and outside the bowel in the peritoneal cavity. Triangular sign, it is a free air among three adjoining bowel loops or two bowel loops adjacent the peritoneum. Here we see here the triangular sign, the free air noted around the bowel loops and the peritoneum in this side. Here another patient, we have a triangular sign around the bowel loops and the adjacent peritoneum. And also we have free air and continuous diaphragm sign in this patient, and also we have also a regular sign, and also we have in this patient air in the scrotum. We call it pneumoscrotum. Peritoneal ligament-related signs, we have falciform ligament sign, inverted V sign, and eureka sign. Falciform ligament sign, The falciform ligament connects the anterior abdominal wall to the liver and extend inferiorly beyond the liver, become the round ligament, and it appears as linear density of the falciform ligament outlined by air in the right upper quadrant, and that it is parallel to the border of the spine. As we see here in this patient, we have football sign here, and there is a linear density parallel to the spine, and this is falciform ligament sign, and also air under the diaphragms. Here, this is the falciform ligament sign, and also on the CT scan, and we see the falciform ligament is outlined by air. Another patient with falciform ligament sign of a pneumoperitoneum with this scoliosis and that linear shadow parallel to the spine. And another patient with CT scan with falciform ligament sign with the pneumoperitoneum. Inverted V sign, two lateral umbilical ligament in the pelvis outlined by air and they create an inverted V. It is seen as oblique linear opacities extended from the umbilicus to the pelvis, and sometimes we see only one ligament. As we see here, large amount of pneumoperitoneum and inverted V sign. Here it is connected to the umbilicus, and these are the lateral umbilical ligament giving the inverted V sign. And also, as we see, a football sign in this patient. Also, another example of inverted V sign. Here, lateral ligament. It is outlined by air in this patient. Eureka sign. It is a thin, dense, linear midline structure that runs from the bladder dome to the umbilicus. As we see here, this is midline linear structure outlined by air and extended from the bladder dome to the umbilicus. Right upper quadrant sign, we have hyperlucent liver, and we have anterior superior oval liver, and we have also the ligamentum teres sign, dog gap sign, and hepatic edge sign, and dolphin sign. Hyperlucent liver, it is a relative hypodensity of the air collecting anterior to the hepatic surface, replaces the brightness of the hepatic shadow. Anterior superior oval sign, it is, we see it as a numerous round or oval or pear-shaped lucency projecting over the liver shadow anteriorly. And as in this patient, we have geographic air over the liver anteriorly, as we see it in the sketch here. Anterior subhepatic space-free air, it is anterior subhepatic space-free air tend to be vaguely linear in shape, and visible medial border of the liver is often seen by the fat. Also, it is hepatic edge sign and appear as saucer or cigar-shaped collection of air running along the inferior subhepatic space following liver contour. As we see here, this is the fat. We should differentiate the fat from the subhepatic free air. As in this patient, we see the fat here and the air in the subhepatic area due to pneumoperitoneum. Fissure of ligamentum teres sign. It is visualization of extrahepatic portion of ligamentum teres. As we see here, this is the ligamentum teres sign, and here we see the falciform ligament sign, and we see here the regular sign. Also, we see the air under the hemidiaphragm and extended to the midline with lucent liver sign. Dog sign. It is a triangular focus of free air that accumulate in the Morrison pouch, and this is the Morrison pouch superior to the kidney between the 11 and the 12 rib, and this is the shape of the triangular sign. This is as in this hat Italian dog hat. It is a special type of hat. Gas in the Morrison pouch, as seen as triangular in shape, concave the medial border, position inferior to the 11 ribs, and position superior to the right kidney. As we see here, as in this patient, dog cap sign in a neonate with perforated necrotizing enterocolitis, and we see triangular air in the right upper quadrant, as we see here in the Morrison pouch. Another patient with the triangular shape radiolucent area in the superior to the kidney in the Morrison pouch, dog cap sign. Decubitus abdomen sign. We see in this patient, the patient is in the left lateral decubitus. It is cross-stable X-ray, and we see the air. It is overlying the liver, and between the liver and the abdominal wall, and this is pneumoperitoneum. Lethal sac air sign or gas sign, and we see that this is the cobula sign, as we see here, the air under in the midline of the dorsal spine below the heart, and we see the lethal sac sign here, gas in the lethal sac. The lethal sac is a potential space, and it is connected to the greater sac through the foramen of Winslow. Dolphin sign, it is outlining the long costal muscle slabs of the diaphragm and is also projecting over the liver. As we see in this example, the diaphragm muscle slabs seen as a radiolucent line, and it is projecting over the liver. Other signs we have football sign, cupola sign, and subphrenic lucency sign. Football sign, we need a large amount of air to visualize it as football sign, large oval appear as large oval radiolucency with sharp interface with the parietal peritoneum. As we see here, this is the football sign and the sinuate with sharp interface between the air and the parietal peritoneum. As we see here also a regular sign outlining the bowel wall. This is a football sign in adult with a regular sign also we seen as the wall is outlining between and outside between air inside and outside the air, and this is the football sign in adult patient in supine film. Cupola sign, it is arcuate lucency that overlies lower thoracic spine, seen just inferior to the heart. The term cupola comes from the dome, such as of this famous dome, of the Domo influence. As we see in this patient, there is lucency overlying the dorsal spine, and it is below the heart, and this is a cupola sign. And this CT scan, when the patient is supine in position, the air in the peritoneal cavity will accumulate anteriorly in the cavity beneath the central tendon of the diaphragm in the subphrenic space as in this patient. Here we have also air under the right diaphragm and air under the central tendon of the diaphragm, similar to cupola sign in this supine film. Subphrenic lucency, the radiolucency seen below either the hemidiaphragm. Continuous diaphragm sign, massive pneumoperitoneum will have sufficient air beneath the diaphragm, left and right. Hemidiaphragm contrast by the free gas. As we see here, large amount of gas, and we see the continuous diaphragm sign in pneumoperitoneum. Also, if the gas above the diaphragm, we see in cases of pneumomediastinum, the continuous diaphragm sign. Double bubble sign, subdiaphragmatic gas under the left hemidiaphragm, two collection of gas overlapping each other, subdiaphragmatic free gas and normal gas within the fundus, as we see here, free gas under the left hemidiaphragm and gas under the fundus, and we see double bubble sign. Crescent sign, free air under the diaphragm, is demonstrated in the chest X-ray or lateral decubitus, easier to see under the right diaphragm. You know why? As we see here, free air under the both and left hemidiaphragm, giving the appearance of a crescent shape. Thank you for listening and hoping to see you soon in another talk.